You've probably heard that or felt that exercise would help your RSI, and it will if it's approached properly. But it can also make matters significantly worse if it's not approached properly. Many people have told me how they've done themselves in attempting to heal. They got inappropriate exercises from a trainer or a group fitness instructor, and sometimes even their physical therapist has prescribed inappropriate exercises for them. So here to help us sort all of this out and what's a good idea in terms of exercise and what isn't is our Chief Medical Advisor, Dr. Robert Markison.
Glad to be with you.
So what are the top problems that people have when they're exercising? I know you've talked about the palms down position. Maybe you'd like to start there when you're doing a plank or a push-up or something.
Right, okay, so if you think of the upper limbs, everything in the upper limb that moves, including shoulder joints, elbows, and so on, are basically moving on the Fibonacci spiral of, and so now we put a point of light on a finger, for example, and you follow that point of light and you're looking at a seashell, and that's a wonderful natural movement in the digits. And then you look at what happens if we go like that, pronated, palm down. Well, we twist and stretch the extensors and flexors, and we violate a bell-shaped curve called the Blix, B-L-I-X curve, where we're going to fail under load or repetition, because now having stretched these actin myosin fibrils to near fatigue, inappropriate muscle fiber lengths of sarcomeres, then you're going to fail under load or repetition. You're just not using them the way they were intended to be used. And it's obviously an extrapolation of the swing of the walk that we're looking at. So I'm swinging and I'm walking, and there we are. We have a somewhat vertical plane running through the hand, wrist, and forearm. When we transgress it into real flat-handed pronation, we can have some significant troubles, including a discrepancy in bone length where you're pistoning the ulna back and forth against the carpus, and having trouble with this combined pronation, ulnar deviation, which you really, really want to avoid. It took so much evolution to get out of being a reptile or an amphibian with a pronated posture that we shouldn't turn back the evolutionary clock in service to a flat input device.
What would you say to someone who was they heard that they had weak muscles, not understanding that the weakness can be a sign of severe injury and scarring in the tissues, so they start doing wrist curls with...
Right, okay, so then it's the fantasy, you want to build up more muscle mass, and that's the defeat and undoing of many people who otherwise might resolve inflammation, then gradually recondition. But if you think that putting on a mantle of muscular mass is going to help you, you're way off base, because you're ultimately just going to create more trouble. You're going to load things that you don't want to load. For example, since there's a 10 to 12x force couple or force amplification from thumb pad to the very vulnerable thumb trapeziometacarpal, aka basal or carpometacarpal joint. So 1 pound there is 10 to 12 pounds here. 20 pounds here, well, you can just imagine you're up about 200 pounds registering at an intrinsically unstable joint. So last thing you really want to do is have that distal to proximal, meaning far to near, progressive loading of joints that's going to exacerbate trouble. So it's a big mistake to do weight training when you're trying to resolve inflammation. Same goes for overstretching, where you can exploit moving members by overstretching and stretch the tendons, Chinups and obium. You don't have to do that.
You know, I'm glad you brought that up, because if you go and search RSI on YouTube, the top 500 hits will be, here's the magic stretch. Here's the stretch. And very often they're inappropriate. They're stretching from the tip of the finger rather than protecting the joints. They can often be very painful if someone has RSI. Stretching can be agony. And I'm really not convinced that it's helpful, as you just said.
Well, I'll give you another piece of information, which is and I'm regularly, and you have to forgive camera shake, but I'm always doing ultrasonography. So you can see out there is the ultrasound machine, which is good high resolution to look at dynamic anatomy. And you can watch my forearm as I do this. I was born with prolonged muscle bellies extending into the carpal tunnel. So I go like that. I'm at lean circumference at the wrist and forearm. I go like that, and you can see my muscle mass going out there, crowding, dynamically crowding my carpal tunnel and the median nerve as my muscle bellies go alongside the tendons. And so if I were stretching like this with a little bit of carpal tunnel, wow, I'm driving a geometric wedge of muscle tendon unit into a tunnel that's already at risk for being tight in the interest of stretching. That can't be so good. Now I'm lean. Now I'm packed. Same thing, you can have muscle bellies called lumbricals, Latin for worm, that originate from moving members, the profundus deep flexors. So you can pack that way. So you're tightly gripping something like a bar, chin up, whatever it is, and then you're packing your carpal tunnel from far to near. Not everyone, but you have anatomical variation within the lumbricals such that you can be your own undoing. That combination of weight training or overstretching and packing. Same thing with the wrist tendons, the de Quervain veins, stenosing tenosynovitis, for example, which is the thumb extensor, short extensor, and abductor. So you can have a musculotendinous wedge through a fiber and bone cylinder, and you go like that. That's Finkelstein's test to confirm first extensor compartment, de Quervain veins, stenosing tenosynovitis. You wouldn't want to do a stretch that takes you there and tempts fate by pushing that muscle tendon unit, tenosynovium, into an unyielding fiber and bone tunnel. You have 6 tunnels across the top of the hand. Most commonly involved is that one, but you can also involve the 6th extensor carpi ulnaris tunnel. And so this overstretching and loading and weight training, it's for the birds.
One of the things that I've learned as a fitness instructor and other ways is that very often people think that they need to stretch when they actually need to strengthen a muscle. And I will give them unloaded, well, they're loaded by their own arm, but unweighted shoulder exercises to help strengthen the muscles of posture so that people can keep their brachial plexus area free, so it's not all internally rotated. And it's like magic. The minute they start to strengthen the muscles that were weak, the pain resolves. And so it really wasn't stretching that they needed. That was the impulse that they had internally, but it was the lack of strength that was doing them in. But with that, I really emphasize that the minute something feels too much, people need to stop immediately and not.
Right, so you're moment and clock bound insofar as you stop if it hurts at the moment, and if it hurts more the next day, you've simply done too much the day before. And you never want to exercise. I see a lot of people trying to run away from the plague, and they're outside huffing and puffing under their masks, and they're exercising to exhaustion, which shunts all the blood away from the guts. In the middle of a plague, you understand that you have T cell processing at gut level, and you have Treg cells, T regulator cells populating the gut. And as soon as you shunt blood away, you're going to lose immunity and at risk leaky gut syndrome. So now partially digested food particles are going to leak out into vulnerable targets, musculoskeletal, neurological, and so on. So your gut integrity matters tremendously, and you rob it of 1, T cell and other associated immunity, and 2, this permeability or secure gut lining. Because if you start to leak and you fail to modulate T cell immunity at gut level because you've shunted all your blood to these lower limbs and running muscles, you've done too much. Now, if you're not hydrophobic, a little swim with some subtraction of gravity is great. That's terrific, because then you have circumferential, 3-dimensional, mild resistance, and you move through water, whether you're swimming or just in place with light aerobics. That's a wonderful thing to do.
I agree. And I'm happy that you brought up this exercising to exhaustion point, because in the fitness industry, I have always puzzled as to why anyone would do reps to failure. It's that last rep that will injure you when you lost form because you were working so hard to get that last rep in. The fitness industry promotes the idea that this will make you stronger, but from my vantage point, this will injure people because they're fatigued, they lose their form, and I know many cases where people have injured by doing too much. Whereas if you start exercising, I do not use weights with people until their form is perfect. And then if they can do one set perfectly without exhaustion, you know, and that will depend individually upon the person, then very, 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 very gradually you might add some light weights, but it's done exquisitely carefully. I wonder what you think about that idea of that.
I think that's fine. There are two phases that should not overlap significantly. One is resolve inflammation, and two is recondition. And we spoke about it on a previous segment. I mean, there's wisdom in these use of little bao ding, little Chinese iron balls, because I'm balancing small muscle, intrinsic muscle in the hands with the larger muscles in the forearms, and a nice concerted effort to balance small and large. I mean, for me, that's great. I don't need to be doing neck, thorax, upper limb exercise beyond a little swim and a nice walk, and that's it.
The other thing that you just brought up, Dr. Markison, is that things are backwards. People are over-exercising these tiny muscles of the hand and forearm and not doing anything at all on the proximal end. So their muscles of posture are basically getting very deconditioned. They can't hold themselves up without slouching into a backrest. And you can't use your arms properly unless you have core strength. So maybe you'd like to talk about that imbalance.
Well, critically important. I couldn't agree more. If you don't have core strength, including cervicothoracic musculature, if you don't breathe well, which to me is diaphragmatic. Since I grew up as a woodwind player, I mean, it was really about don't recruit all these upper thoracic muscles to breathe. Nice belly breathing, and that's diaphragmatic breathing. Stay well oxygenated. Maintain without resistance exercises proper neck postures, because 3 inches forward in a facial plane can triple the force, biomechanical force running through the neck muscles. They figured that out at Ergonomics, University of Michigan. So straighten up and fly right, because as soon as you head forward, you're gonna put a lot of static loading on those muscles. And biofeedback through a EMG biofeedback practitioner, hopefully coupled with hand temperature biofeedback, so you can learn to put good circulation in the hands, and proper use of these can be very, very helpful. Little EMG biofeedback, which is non-invasive, information out, no electricity in, with a capable biofeedback practitioner, is terrific troubleshooting. And there's a YouTube video of myself with Kathy Bender, B-E-N-D-E-R. Look for Markison Bender biofeedback on YouTube, and you'll see how productive that can be, because a little troubleshooting goes a long way. Head forward, bad idea. Limbs forward, bad idea.
Well said, Dr. Markison. So I want to thank you so much for coming, sharing your vast knowledge with us, and we'll have you back on the show really soon to do more education about repetitive strain injury. So thanks again.
Always a pleasure. Thank you.
Thank you all for watching. And if you have a question for Dr. Markison, please let me know. Thank you.